Hopefully the transcription is starting as well. Yes, it has started.
Federico, shall we start?
Yes, let's
Many.
start. Let's start. Good point. Yeah. Okay, so welcome everyone. So this is session. This session is being recorded. So the session is run by the Brunel Center for AI as part of the 2024 Thought Leadership Seminar Series. There's one every year, so as I know, so it's all very exciting. So welcome everyone to the session. May I please ask everyone to mute yourself, just in case there are any spurious noises coming through. If you can mute yourself, please, that would be great. Thank you so much. Okay, the speaker today is Dr. Mai Elshehaly, who is lecturer in visualization at the GI Centre at City University of London. And she will be giving us a presentation titled When Do Decision Makers Use Visualization? A closer look at the relationship between data and decision making. So I think I'll just leave the floor to you, Mai. You've shared your screen already. So go ahead when you're ready.
Right. Thank you very much. First of all, thanks for the introduction and thank you very much for inviting me to give this talk. So as you said, the title is When Do Decision Makers Use Visualization? I just want to make sure that everybody can hear me all right. If I can get a thumb up. Sorry, I'm looking to the side because I can see you on my screen. Okay, good. Excuse me. Right. So when do decision makers use visualization? Just to set expectations at the beginning of the talk, this is an ongoing research. So I hope I can give you an answer, but it won't be a definitive answer by the end of this talk. But what I'll do is I'll try to sort of dissect the question and kind of break it down into sub-questions, if you will, and we try to answer them together and hopefully piece together the ideas and requirements for decision makers to really make use of visualization. So I'll start with this idea of dissecting the question. And obviously, we have two main components to this question. First of all, the decision makers, and second is the visualization. So let's have a look at these two components together. First of all, who is a decision maker? It's somebody just like you and me who makes a choice of one course of action over other alternatives. Now, these decisions can be at a large scale. So like evacuating an area before a hurricane strike or an airstrike, or all sorts of large-scale decisions that can have an impact on the life and livelihood of a number of people, or it can be a very personal scaled decision where it's something to impact my own sort of well-being, for example, like adhering to a prescribed medical treatment. And so these kinds of different tasks for decision makers really vary in terms of the scale, in terms of the context in which they take place, and sort of the data that is necessary to support them. On the other side of the question is the visualization. So what is a visualization? And to answer this question, we can look at different examples of visualizations that we see around us that range from things that are highly interactive, like dashboards, to things that are more static, like infographics that are included sometimes in policy documents or in reports. We see more things that go on the very realistic end of a spectrum, such as visualizations of physical phenomena like air fluid dynamics, for example, versus the more sort of comic style visualizations that really don't care much about the realism aspect, but more about conveying a message in a way that kind of stimulates people's thought. And we also look at the different scales of the data that can be included in a visualization. So people can either include things that are very personal, such as personal habits and timelines of things that they do in their day-to-day sort of activity, to the very high scale or large scale data, population level data that we see typically also in data journalism and scrollytelling, so-called scrollytelling applications, where you can scroll through a series of visualizations along with narration to tell you a story about a situation around the world. And we see these most commonly also in things to do with global warming and climate change. So the scale, the kind of interaction, the level of interaction, and the type of realism and different aspects of the design really makes it very difficult to pinpoint what exactly a visualization is. But perhaps one way we can look at visualization is to really not concern ourselves too much with the diversity of the field as it stands today, but looking back at the very definition of the area of visualization. So a little bit of a history for visualization research dates back to the 1980s, where the field of visualization research was defined for the first time in an NSF boardroom in Washington, D.C., when a group of scientists, basically, who specialize in graphics and image processing, came together and came up with this definition. So they said that visualization is a method of computing that transforms the symbolic into the geometric, enabling researchers to observe their simulations and computations. Visualization offers a method for seeing the unseen. It enriches the process of scientific discovery and fosters profound and unexpected insights. Now, I've set highlight on two elements of this definition here. First of all, the researchers, and second is the insight. And really what struck me when I read this bit of history for the first time is how very well defined and very targeted the field of visualization started, as it was really about the researchers that have data that they know their data, they have been running these simulations, they are basically domain experts in their field, and they just wanted some visualization to generate some sort of insight that could support their line of interrogation of that data. So very specific set of tasks and also set of targets, which is basically to generate insight. Now, one might say that this was a long time ago, 1980s is a long time ago, but surprisingly, this definition, this very confined definition, has had a real impact on the way we've approached application-driven visualization research over the years. This is a figure from what we call the gold standard methodology in visualization research, which is the design study methodology. Whenever I have a postgraduate researcher joining me for the first time, they want to do visualization research, whether it's for their master's or for PhD. The first thing I hand them is this paper from 2012 called the Design Study Methodology, because it really gives a nice framework and it shows the different steps and the different stages that we typically undertake as visualization researchers in order to conduct visualization research and to develop something that is fit for purpose. So it starts with casting, so obviously learning about the visualization field and then understanding some aspects of the problem domain. Casting, which is a really interesting stage of defining who you want to work with, and then you discover the tasks of the people you want to work with as your stakeholders. You design something for them, you implement and deploy, and then reflect and write. So these are kind of the sequences, and we do iterate between them, obviously. So all the sort of feedback loops on the top. So really nice and well-defined framework for running visualization research. Now, the question is, how much of an impact does this early definition of visualization as a field have on this methodology? You can see this in the cast stage, where they describe the types of stakeholders or roles of people that we can work with as visualization researchers to develop visualization. And one of the things that are really interesting around these definitions is that they're very much focused on, again, the idea of domain experts, or the idea of people who are centering their entire tasks and entire roles around data. So like the most important one, obviously, is the frontline analyst. And this is being described in the paper as the domain expert doing the actual data analysis. That's kind of the main target for an audience for visualization. What's really striking, though, is that the word decision makers never appears in the paper. So very much missed in a way. We don't really capture them as a main stakeholder role in this design study methodology. But again, you can say this was 2012, but even as recent as 2022, this really brilliant paper came out by Demara and John Stasko, where they really pointed to a gap in visualization research as an area. So this critical reflection paper looked at the types of the theories, the taxonomies, and the methodologies in which we define what people want to achieve with visualization, so the tasks that people want to undertake with visualization. And one of the things they've observed in these existing taxonomies and typologies in the visualization literature is, again, the missingness of the words decide, decision-making, choose, really nowhere to be found in these taxonomies and in these classifications of what we expect people to do with visualization. So there is a real gap. Now, this is all theoretical, right? But the question is then, how much of an impact does this gap have on practice? And we've really come very close to capturing that gap in one of the studies we ran back in 2021, when they sort of kind of 2020, 2021, so early days in the pandemic, really, when one of the districts that we were working with were commissioning a new commercial visualization software, particularly as part of their response to the pandemic and trying to address population health issues using visualization. So we thought there was a really good opportunity to try and understand the tasks that decision makers wanted to achieve using visualization and how was it being used. So we started interviewing a group of people, including data analysts and including also district level commissioners, and we got really different perspectives from both of them. So the data analyst side of the story was very positive, again, reflecting the fact that creators of visualization software have these people in mind when they design the software. So you can see that the data analyst was really excited. They were saying, using words such as brilliant to describe that particular piece of software. Whereas when we spoke with the district level commissioner, we had a very different narrative and a very different side of the story. Where they were saying things like, it does not tell me much, doesn't take into account the demographics or employment or housing or anything else. So really dismissing a lot of the stuff that was being presented in the visualization software because it didn't match their expectation of the real world situation that they wanted to understand in order to make their decisions. And again, this shows kind of that the impact of the gap in visualization and the way we conduct visualization research on the day-to-day activities and tasks of decision makers. And so the task specification is a very important aspect of this, but also the context in which these tasks take place is really important. So this 2023 paper by Connie et al. Really brilliantly captured that. Again, they've run an interview study, so similar to ours, but more with a larger group of people within a larger organization that had just commissioned Power BI. So they started using or transitioning into using Power BI. And they started asking people about their experience with Power BI and how they are sort of perceiving it as something that hopefully can increase their ability to perform their jobs and help them sort of make better decisions. That was kind of the aim of using Power BI in this particular organization. And they've captured a number of challenges and a number of issues that have been raised by the people who were who they interviewed. And the first one is that training is really hard. So obviously Power BI has a learning curve. There's some people were saying it was intimidating. They felt there was an expertise gap, extensive self-learning. So they had to spend more hours on YouTube videos and trying to work out through tutorials. They needed training during off hours, and they felt that there was introducing more time constraints or sort of more time demand on their already very busy schedules. The second layer of this is the idea that, okay, even if you are trained and you have a really good knowledge of the tool, of a tool like Power BI, the level of expressivity, which is the idea that you can create so many alternative designs for visualization using a tool like Power BI, can be actually really challenging for someone who is not a specialized person in visualization. So they felt that they had visualization knowledge gap, and they felt that the design process itself, so they said, we spend so many hours learning the tool, we spend so many hours then preparing the data to fit it into the tool or sort of load it into the tool in a way that can allow us to visualize it. And then we just click a couple of clicks and we generate something. We don't know if it's the right way of visualizing the data. And we really don't know how much of a narrative this kind of visualization can tell and how it actually informs decision makers. And then the final bit that was captured in this really interesting study was that transitions are hard. So transitioning of practices from Excel or from other tools, which is obviously this is kind of known for any kind of transition to a new tool. So it's not specific to visualization, but really the idea that you are transitioning and changing your work habits and changing everything that you're used to doing also does have a cost to it. So these kinds of aspects that define the socio-technical context in which decision-making using data and visualization takes place are really important in order for us to understand when can decision makers really make use of visualization. And so the first way we can start answering today's question is when is visualization useful really depends on how well the designer or the author of a visualization understands the decision maker's tasks in context. So really needs to be a clear definition of the tasks that decision makers are trying to achieve, not those of the data analysts, not those of the data workers. And we have kind of a slightly different definition for these two roles. So data analyst is the person who has some data sort of expertise, whereas a data worker is somebody who has data as part of their day-to-day description. They interact with data, but they don't necessarily have data science experience. So both types of users are very data-centric, and it's important that we still maintain a really good and ongoing sort of conversation about their tasks. But also what I'm trying to advocate in this talk and in my research in general is that our task analysis really needs to also cater to the specific tasks and the contexts that decision makers operate within, which are significantly different from these data tech savvy people that work with data on a day-to-day basis. And so an example for this task and context specification was a really nice example. I like to use as a project that I worked on between 2018 and 2021, which is called the Qual-Dash project. It was funded by the NIHR, and I was based at the University of Leeds at the time. And the aim of that project was to design, develop, and evaluate a set of dashboards that could be used in different NHS hospitals for a specific purpose, which is quality improvement. So this was the data that was audit data that was capturing different processes that were happening in different units in different hospitals. And the purpose of the dashboards was to present this data back to the people who are working within a unit in order to give them some sense of how to improve their services, basically. And we had a certain set of expectations around it. So it needed to be adaptable enough in order to be deployed, first of all, in different hospitals, but also in different specialties within these hospitals. So we had cardiology units, and we also had pediatric intensive care units. And obviously, these would have completely different data sets and audits that they were working with. But then, despite the adaptability that was needed, it couldn't have been anything like Power BI, for example, because it was one of the really key requirements was that it needs to be really easy to use, meaning that it would be the expectation is for very busy clinicians and healthcare professionals to be able to click one click at maximum, no more than that, and be able to tell something about what was going on in their unit. And also it needed to be safe to use in that it was providing similar information across the organization, so not really giving people different sort of the flexibility to create their own different versions of truths, if you will. It really needed to have that single version of truth to present across the organization. So the Qual-Dash context, again, secondary care hospitals, busy clinicians, no time for training, no time for learning curve, needed to have a trust level kind of, or informed trust level decision making, but using unit level data, so kind of that bottom up communication of data and analytics needed to be supported whilst maintaining information and data governance issues. So the data was not allowed to leave the hospital site. We could not sort of put it on a centralized server or anything. So kind of just that was the context that defined the constraints around the tool that we were developing. And then we started looking at further defining the context of decision making and the tasks of the decision makers who were making those decisions in those different contexts. And so we interviewed 54 people, including physicians, nurses, department managers, support staff, hospital board members, and information managers, and other roles within the trusts. And this was obviously a very rich qualitative data set. So we started doing some thematic analysis with it. And based on it, we explored or kind of extracted about 124 different types of insights. So these were the tasks, if you will. So things like how many admissions happened in a time period, what is the pressure on the cardiology unit, what is the number of patients, STEMI versus non-STEMI, these are different types of admissions, how many cardiology patients are currently in the system, and so on. So these were all questions about data. They were easy to identify and find in the sort of the qualitative and the interview data that we have captured, and we were able to immediately create this list of questions that people wanted answered. So really thought, okay, we've got a really good definition, or at least a good understanding of the tasks that people wanted to perform. And then we published our first paper from the project back in 2018, looking at building some structure around those tasks. So kind of looking at the different task taxonomies and classifications that we have in the visualization literature to try and find some commonality across them so that we can look into the different visualization alternatives that could cater to these, because obviously there was no way we could create 124 visualizations. So we wanted to kind of group them in a way that allowed us to say, okay, this group of tasks can be catered to with these types of visualizations. So this kind of mapping we published in our first paper, just looking at the structure, looking at how we can look into the visualization design alternatives. And then we took that structure back to our stakeholders. So we had a couple of co-design workshops where we asked them to look at different types of tasks. So now we started abstracting away from the specifics they told us in the interviews, and we just kind of made up some tasks that represented groups of tasks. And we asked them to tell us some stories around those tasks in a way that kind of builds a narrative around them. So it's not just the insight that mattered. We wanted to see what else. Okay, so if you have that insight, what's the next question you would be asking? And then how this can lead to a decision or some sort of insight that is being gained. And the nice thing about Qual-Dash that was really a lucky thing that happened really is that we managed, as we analyzed the data that we collected from these workshops, we found that the contexts of decision making were quite self-contained in a way that they didn't actually intersect much. So people who were looking at some quality metrics in a cardiology unit, like a call to balloon, for example, which is a metric that basically measures the time from the time somebody makes a call to the ambulance to the point when they have a balloon stent to save their life. The questions that people were asking within this context about the quality of the service being provided were completely different from the set of questions that people were asking when they were looking, for example, at things like gold standard drugs, where people, whether or not somebody has been discharged from the hospital with a prescription of a gold standard drug. So we really found very little, if any, overlap in the types of questions that were being asked in these different decision-making contexts. And that gave us a chance or an opportunity to really be very strict in the way we structure the visualization, but also in the way we limit the ability to adapt it to different ways, because there was these nicely self-contained metrics that we could sort of build on. And so in more conversations with clinicians, they also gave us some really good ideas as to how they would like this information that pertains to each one of these contexts to be represented. So this clinician, for example, gave us a really nice quote that we ended up using. She was saying, I want something simple that tells me where something is worsening in a metric, then I can click and find out more. And by that something simple, they were very keen on their bar charts. They were saying, clinicians especially, they were saying, if you give me a bar chart, I'll be passing by my computer and I'll see something and I'll spot it. Whereas if you give me another more complicated sort of visualization, I'll put my glasses on and I'll sort of try and figure out what was going on. So we knew at least one bit of design that was really easy to identify. Okay, we want something that is self-contained for each one of these metrics, that had a bar chart, and then the ability to click and look at more information. And so our task in analyzing the interview data and co-design data was then to identify what we call the different subtasks. So subtask 1, subtask 2, subtask 3. These would be the additional pieces of information that they were talking about here when they say, I can click and find out more. So the question then was, well, what more do you need to learn? And so that kind of structure really made it easy to trace their process of how they build different layers of information. And we've taken that into the exact design that we ended up having. We ended up having these qual cards, or what we call qual cards, that have bar charts, and then you're able to click on one and it expands and it shows additional information that matches the different subtasks for each specific metric. And they were interactive in a way that you could connect and link the different views within a qual card. You could also lay them out in different ways so that one qual card can take the entire screen space, or you can have more qual cards next to each other. So it was nicely interactive. And this was all generated dynamically. So we created an engine that would read basically a JSON structure that's similar to the one on the left, that had some specification of the metric that was being visualized in each one of the cards, and then some specification of the subtasks, so the additional information that needed to be displayed as people were investigating that particular metric. And then our engine would take one file, which is which contains the sort of metric specification structures for all cards, and it would generate however many cards based on these JSON structures. So that kind of allowed us to have a nice level of control over the adaptability. So every time we were adapting this to a different hospitals, we were basically going into this JSON file and adapting it to what the people within this hospital, within this particular unit in the hospital wanted to see. But once the dashboards are generated, they didn't need to do much other than explore around and tell us what they can get from these dashboards. So definitely didn't have any learning curve for them. And we thought it was a really good success story. We published our Viz paper in 2020 describing this. But then unfortunately, we did more research. And basically, we wanted to capture how Qualdash was being used in the wild. So we went beyond our Viz paper, and we started sort of doing some observation studies, but also we had installed in the trusts a logging mechanism where we would log how many times people were using the software. And the numbers were quite depressing in terms of the number of times that people were actually using Qualdash. And that was quite a surprise because, again, our stakeholders were involved throughout the entire process, and we made sure that they were part of the entire co-design process. So we kind of started asking questions, and we got some really good feedback. So things like, just wanted to say, Qualdash has saved me hours of work with regards to data I submit to NHS England. It's fab. There were less sort of positive things that people were saying. For example, the graphs steadily decline, and that can't be accurate. So this is a case where it wasn't matching what they would expect to see. And then digging a bit deeper, we would find things like the audit team, for example, must be behind with data collection. So this is the kind of thing, a situation where, again, somebody who's very data driven in their job are very happy with the tool. But again, when it comes to real world decision making, things that go beyond the data and the insight can really hinder the ability for visualization software to play a key role in decision making. And so if I were to go back and redo visualization for Qualdash again, in reflection now, I would not really ask the question about the insights and just stop at that. It would probably be more about the questions around the process that comes before the visualization is generated, but also after that, and what decisions these processes can lead to. And this is where we can say, within this framework that was presented in the 2023 paper, we had, where we struggled with Qualdash most was this transitioning from current practices into new practices that would make a tool like this a success. Even though we had no training required, we didn't require any expertise in visualization to design their own dashboards. This particular last bit was really a struggle for Qualdash. And so the second part of answering today's question goes again beyond, so tasks and context within those tasks are very important, but also really the level at which visualization is being useful to decision makers depends on how well we, the designers or authors of visualization, can understand the practices that go beyond the data insights. And we've seen this more and more as we started working with more and more sort of real world data or routinely collected data. And this figure here is shared courtesy of Dr. Tom Lawton from Bradford Teaching Hospitals, where he was saying that this was from electronic patient record in a hospital. And if you just look at the data insight in a figure like this, you have the curve on top, which is the orange curve here. This shows the non-elective admissions to the hospital really spike around September 2017. And if you look at the actual situation on the ground, there hasn't been any increase in the number of people that were coming through the door of the hospital. What had happened, though, is the process of record keeping has changed within a day in September 2017, because the hospital had just purchased a new software for electronic patient records. And the way that the data was being entered in that electronic patient record made it easier for people who were still kind of getting training, excuse me, and learning their way around the software to click on non-elective versus elective admissions. So again, this is a case where you have data insights that can tell you a story that is very different from what is happening on the ground. And as we transition more and more into working with routinely collected data beyond health as well. So now for the last few years, I've been working with this really brilliant asset called Connected Bradford Data, which includes health, primary care and secondary care and social care data, along with policing and other sort of bits of public services. And it's all linked and interconnected. So you can really look into social determinants of health and looking at different aspects of people's lives in Bradford. But again, as you look at these real world data, which is data captured in the wild, not really captured for research purposes, the more we work with this type of data, the more we appreciate the need for the real world narrative as opposed to just the data insight. So we started by running some interviews, again, with stakeholders who might be interested to use Connected Bradford data and really understand and make decisions for population health management. And we've kind of identified a number of initial or preliminary tasks that they wanted to perform, including, for example, identifying the rising risk population. So if you were looking at a specific area, for example, or in different areas, in which area are we going to get the maximum diabetes number of diabetic patients in the next few years, for example. So kind of looking at this idea of rising risk in the population, identifying obviously inequalities and bottlenecks in the system. And then sort of the nice thing when we talked about this with decision makers is that they were able to immediately link those insight-driven tasks, so things like identifying or characterizing, with action or sort of actionable decisions, such as planning services or assessing the impact of a particular intervention in order to either scale it up or scale it down. So this was a really nice case where we had a nice mapping between, or a nice understanding between, how insight can lead to decisions. But again, looking at the real world data, we ran into the same sort of issues that we were just describing earlier, which is the idea of how the data comes to be. So the provenance of the data really matters. For example, this was an example dashboard that we created and had conversations with commissioners about, where we started looking at, for example, a cohort of autism. And this is an example insight that you can immediately get from the dashboard, particularly from the pie charts on the right. The number of white children with autism diagnosis in Bradford is almost double the number of Asian children with the same diagnosis code. Obviously, this is not the case on the ground, so it doesn't really reflect the reality. And when speaking with different stakeholders, you could get the sort of soft intelligence around this, or sort of the qualitative side of the story that really brings you a bit closer to the reality. The fact that there are barriers to diagnosis in ethnic minorities, such as cultural biases, such as concerns by parents often being dismissed by professionals, or children being described as just clumsy. Different services also have different ways of coding or entering their data on their system. Some of them are still keeping data on paper, especially in under-resourced areas. So really, all these bits of information need to be included in order to contextualize that insight that you can get from the data in order for decision makers to trust it enough so that they can make decisions based on it. And so this brought us to a really interesting paper by Lin et al. That was describing this idea of data hunches, where the tool itself allows people to annotate the visualization, add context, and tell where the data is really not meeting what they expect about the real world. But then the question for us was, okay, if we were to add these data hunches, will that be sufficient in a population health context? And so we started looking at a case study, again, autism, in addition to another condition called developmental disorder of motor function. And we found in connected Bradford data at the time when we queried for these two conditions, numbers that were not really huge in terms of, in comparison to the size of the population. So 154 is a very small number. And we showed this to a domain expert who immediately told us, I would expect this number to be at least 5 times as many as the autism cohort. And so this is kind of a data hunch, right, from the Lin et al. Work. This would be a data hunch that we would be able to sort of enable people to annotate and tell that, give that context. But then the question was, is that enough? Does that actually inform decision makers if you just have that data hunch? And the answer to that question was no. So we ran a number of co-design workshops, again, with 90-something participants from different backgrounds, but if also different roles in population health management. And we asked them, what do you want to do and how do you want to use visualization, and what would be, you know, what can visualization do to make your life a little easier if you're making decisions based on data like connected Bradford data. And we published a paper around about the results of this of these workshops, and the particular sort of themes that came up from our thematic analysis of the results of the workshop were also detailed in the paper. But one of them that really stood out in many of the comments that we got, especially from commissioners and decision makers, is that the dream is to be able to look at the pathways through services from the perspective of a child going through the journey rather than an outside perspective. So this idea of experience and lived experience really stood out in the results of these workshops. And the idea of that experiential view of the data was also captured in a lot of the sketches that we captured in the co-design workshops. So people really wanted to see that journey, that human story, that timeline of events, and then sort of use data as a way to contextualize that, that sort of lived experience. So the argument that we started making from that point onward has been the opposite to the data hunches argument, where in data hunches, again, I'll go back to it, the main sort of artifact is the data, and then you have the narrative or the text or the real world narrative to contextualize the data. Whereas in the case of our approach, which now we call it the CLEVER approach, standing for connecting lived experience with visualization of electronic records, we are asking, the key question we're asking is, where is the real world narrative, which is not data-centric? And so we started developing this early prototype that really is about the narrative. So the different services that exist on a pathway. And within each one of these services, we tried to sort of mix narrative with data. So you have the text narrative, you can click through, you can sort of get a story along with data feeding along with the story. So it's mainly about the narrative, but the data is almost like a second-degree citizen, where it complements the narrative where it is needed. And then we also started playing around with this idea of embedded dashboards. So we're embedding the dashboards, we're embedding the actual data insights within the overall sort of narrative that has been told. So this pipeline view is actually based on one interview. So we took the interview data, started sort of plotting it, and then we started injecting the actual electronic patient record and routinely collected data within those different pieces along the narrative. And we also proposed a theoretical framework to a preliminary one anyways, in our CLEVER paper last year at Viz. So this, again, CLEVER is a framework for connecting lived experiences with visualization of electronic records. And again, the argument that we made is that we need to focus on the real world narrative, and we really need to focus on the qualitative data. And so we started looking at what aspects of that narrative are helpful to decision makers across the different stages of decision making. So on the sort of top here, you can see the different stages of decision making, which are broken down into building their tacit understanding of people and situations, and then building tacit rules that underpin decision making. And under each one of these are the different bits of knowledge or knowledge constructs that they need to build in order to make sense of the world around them. And we started looking at, for example, if we're looking at how the population manifests itself, both in terms of the how it's manifested in the routinely collected data, but also how it's manifested in the way people talk about this population. And we started looking at the different decision contexts in clinical, service level, and district level. And obviously underpinning all of this is the community's lived experiences. And so the cells of this framework are really about identifying the bits of human information or human knowledge that need to be captured in order to enable visualization to really support decision making for this particular stage of decision making. And we found that these stages also kind of nicely align with the elements of the social science side of the story, co-design and co-production. So co-design is very much about building in a participatory way, understanding of what the current situations are on the ground, and co-producing sort of answers to the questions or interventions that can help alleviate some of the existing problems. But our current sort of design and effort and sort of development effort is mainly focusing on this first stage, which is basically looking at how population can manifest itself, again, both in the routinely collected data, but also in how people describe this population and the care pathways that they go through, so the different services that they encounter in their journey. And this is one of the prototypes, again, that are currently in development that capture these two elements. So this is about the rows in this matrix are, I'll bring you a static view first, and then I'll come back to the animation. But each one of these rows basically is a context of care for people with autism, young people with autism. So primary care, school, nursery, home visits, and so on. And within each one of them, the cells represent what people talk about when they talk about this cohort in that particular context. So within primary care, people talk about or have conversations with their GP about speech and language concerns, social behavior, eye and vision, motor coordination. There could be more than this, but these are the ones we've captured so far. Schools and nurseries, they can talk about the special education need provision, earlier foundation stage profile, and so on. And again, what we are looking at the very high level of the screen here is just this these human knowledge constructs and how they link to the underlying data, but they also how also they link to the qualitative. So how many mentions in the community, for example, based on the qualitative data that we've collected. And again, this is not complete data, but we kind of try to build around it as much as we can. And then you click on a button and actually see the dashboard behind all of this. So again, the dashboard is not the first thing you encounter as you go to the visualization. You really start with that human model of the knowledge around this cohort, and then you can sort of expand and look at the data that sits behind. So to wrap up, sorry, I'm running a bit over time. Because I said I was going to talk for 40 minutes. But yeah, so to wrap things up, I think the main thing really for visualization to be useful for decision makers is for us to obviously, as I said, understand the tasks in context and understand the practices, but really to consider them as key stakeholders of visualization and really revisit the way we define the cast for visualization research. So it's not sufficient to just work with the data analysts or the domain experts, but it's more about sort of building communication with the decision makers and the communities that are represented in the data, understanding their lived experience, and then trying to match that to the data and then finding out ways of also telling the data story back to them so that we can sort of continue having this conversation with them rather than it being just a one-way communication between the decision makers and the communities. When it comes to communication with data analysts, the solid lines I've used on this slide are representative of the communication that is already well studied in the visualization literature, whereas the dashed lines are the areas that I feel like are really underdeveloped, particularly where it comes to communicating with decision makers around things like the data provenance, so how it came to be, who enters the data, how they enter the data, why was the data entered in such a way. It's really important to communicate this information to the decision makers in order for them to gain some trust in the data. Things like implicit error, analytic potential, and decision provenance, all these bits of information that really need to be transparent and communicated transparently to the decision maker. So to summarize, this is my last slide, or yeah, one more after this. When do decision makers use visualization? When visualization is embedded in real world practices and culture, when it conveys stories and acknowledges the uncertainties of real world stories, when it contextualizes data insights with lived experiences, fosters interest and advocates for change. And this is where this experiential element really is important, but we're still exploring how to convey that. And with that, I thank you. And I just want to remind you, if you don't know already, CGVC, which is Computer Graphics and Visual Computing Conference for this year, is coming to City in September. So we're really hoping to see many of you there. And the submission deadline has been extended to the 17th of June. So we really hope that you could make it. Thank you very much. And I'll stop sharing my screen so I can